So I lied to you guys. There is an additional part of 5C. I totally forgot about this, but we'll talk about this just briefly. If you remember back in Section 4, it has all the team roles for your cardiac arrest. Well, this is essentially the same thing, but it's not cardiac arrest. It's just for ACS. So you have your 6 different team roles. That's obviously assuming your best case scenario that you have a 4-person engine crew on scene and a 2-person ambulance on scene. If you look at the bottom, it has this little acronym and it's STEMI, but it's not what we think of STEMI. And it's more or less just talking about how we're going to treat this scene. So S is scene coordination, T is transport logistics, E is efficient data acquisition, M is manage airway, and then I is interventional. So just a kind of a clever little way to remember how to run this scene. I won't go step by step for every single box on this, but just if you look at it, you've got P1, P2 on the sides, your left and right side of the patient, and then P3 and P4 at the head, and then P5 and P6 are at the bottom or by the feet. Your P4 up here is going to be your scene coordination, and you're always going to be outside of this ACS triangle. So you're going to be, talking to family or monitoring the times of the interventions, if you have the tablet documenting the times or when the interventions were done or anything like that. And then you assume the duties of P5, P6 if limited to 4 rescuers. P3, that's your airway guy or girl. You'll be applying capnography, O2 if it's needed, airway management. Your P1 is going to be your interventional paramedic. So they're going to be the one that establishes IV access, administers any medications such as aspirin or nitro, fentanyl, or norepi if it ends up being indicated. Your P2 is going to be in charge of your vital signs, applying the 4 lead and 12 lead, and then your defibrillator pads if that's indicated. P5 is going to be outside of the ACS triangle as well, along with P4, and their sole responsibility is egress and ingress. So they'll assist with equipment management and stuff like that, but they're going to make sure that you got a way out for safety reasons, or if it's just a critical call where you have a way to get out quickly and get that patient transported. And then P6 is your treatment implementation paramedic, also always outside of the ACS triangle at the lower half of the patient. So they're going to be talking to the patient, they're going to be gathering the history, reviewing the 12 lead, diagnosing the 12 lead, determining the appropriate destination of the patient, alerting the STEMI, or doing the STEMI alert on the phone, whatever that consists of, or all that consists of, sorry. So that's your team roles for ACS. It's just essentially telling you responsibilities as the paramedic. You're going to delegate, so you're going to assign these people to different parts of your role. If you're the ambulance paramedic, most of the time you're going to have a fire paramedic on scene, so you can assign them to that P1 to get you all your stuff, or the fire paramedic can be P6 as well. Preferably P6 is usually the transport medic, mainly because they're the ones transporting that patient. So, but it can be interchanged if it needs to be. So that is pretty much it for your team roles.